Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering schizoid and schizotypal personality disorder. Before we get started, please guys, you know you're going to love the video, like the video, subscribe to the channel if you haven't done so already, and in the comment section, please engage, help the algorithm, let me know what you'd like to see me cover, let me know what you thought about this video. So let's get started. Schizoid personality disorder. It says people with schizoid personality disorder exhibit, look at this guys, a lifelong pattern of social withdrawal. So it's not like, they have just gone through a phase. They have a social life, they go through a phase, and then they have the social life again. No, they've always been like that, always want to be like that. Lifelong pattern of social withdrawal. They're somewhat expressionless and operate with restricted range of emotional expression, which means the people with this type of personality, you will never see them enthusiastic or excited about something. You will never see them on the end of the spectrum of the emotions, one end or the other. They remain emotionless. Symptoms of schizoid personality disorder appear in childhood and adolescence. These young people tend to be loners. Remember, they're socially withdrawn. So they like to be by themselves. They do poorly in school, and they're the objects of ridicule by their peers because, of their odd behavior. The kids will call them weird or a weirdo. People with this disorder do not seek out, nor do they enjoy close relationships. So it's not like they want to have a close relationship, but because they're considered weird, they can't have them. They don't want it. They do not seek out close relationships. Look at this. Neither approval nor rejection from others seem to have much effect. They could care less. Friendships, dating, and sexual experiences are rare. If trust is established, the person may divulge numerous imaginary friends and fantasies. I don't know why I don't have that underlined, because that's a very important part of the schizoid personality disorder in disorders. The imaginary friends and fantasies. Individuals with this disorder may be able to function well in a solitary occupation, being by themselves, such as being a security guard on the night shift. The patient may describe feelings of depersonalization or detachment from oneself and the world. They feel like they're not within their own body, they're out of it. Nursing guidelines. Nurses should avoid being too nice or too friendly. That will garner resentment and also distrust. Do not try to increase socialization. Don't try to force them into groups they don't want to socialize. Do not try to force conversations. Patients may be open to discussing topics such as coping and anxiety. Make sure you conduct a thorough assessment, identify the symptoms that the patient may be reluctant to discuss. Protect against ridicule from group members. Whenever they're in group therapy and a member calls them a weirdo or a psycho, you need to make sure you establish those boundaries right away, because the whole point is us helping that patient to get better. Treatment. Patients with schizoid personality disorder tend to be introspective, okay? Psychotherapy, group therapy, but remember, in group therapy, make sure you have those clear boundaries. We can give them antidepressants as ordered for the anxiety, antipsychotics. If that patient is out of touch with reality, they can get some antipsychotics. That is your schizoid personality disorder in a nutshell. We're going to jump now to I cannot never pronounce that. Schizotypal personality disorder. Now, with people with schizotypal personality disorder, they don't blend in the crowd. They don't blend in. Their symptoms are strikingly strange and unusual, from their appearance, the way that they dress, the way that they talk. Magical thinking, odd beliefs, strange speech patterns, the way they talk, and inappropriate affect are hallmarks of this disorder. Remember that word hallmark. Classic, cornerstone. When you see those words, whatever comes before or after that they're trying to describe, you need to know, because that means when you see a group of these manifestations, that's what you need to be thinking about. It's more common in men than in women. Let me move this a little bit. They have severe social and interpersonal deficits. It's not easy for them to make friends. They're socially awkward. They experience extreme anxiety in social situations. Contributions to conversations tend to ramble with lengthy, unclear, overly detailed, and abstract content. So when they do try to have conversation, at the end of the day, it's just very awkward, okay? An additional feature of this disorder, sorry guys. I forgot to turn that off. All right, an additional feature of this disorder is paranoia. They are overly suspicious and anxious. They tend to misinterpret the motivations of others as being out to get them. So you're just trying to be friendly, and they see it as you're trying to take something from them, or you're trying to manipulate them, okay? They take motivations of others as being out to get them and blames others for their lack of social isolation. Let's stop right there. Do you see a big difference between the schizoid and the schizotypal? And the schizoid, guess what? They didn't even care for social interaction. They like being loners. But the schizotypal personality disorder, they would like that socialization, but they're just awkward. And so they blame others for their lack of socialization, but they want it. Where in a schizoid personality disorder, they don't want the socialization. Matter of fact, they could care less what people think about them. All right. Where was I? They're overly suspicious and anxious. They misinterpret the motivations of others as being out to get them, and they blame others for their social isolations. They have odd beliefs. They tend to be very superstitious. They have magical thinking, such as, he caught a cold because I wish he would. Patients with this type of personality, a lot of them believe in like witchcraft or magical powers, okay? Hallucinations and delusions might also exist with schizotypal personality disorder, but to a lesser degree and only briefly. The patient with schizotypal personality disorder, it's easier for you to bring them to reality and help them to understand that whatever delusions that they may be having versus your schizoid, okay? Or even your patient, especially your patient who's schizophrenic. The patient who's schizophrenic, they have a solid belief in whatever delusion that they have. But with the schizotypal, it's easier to convince them and show them that, you know, what you're thinking really is not reality. A major difference between this disorder, which is the schizotypal, and schizophrenia is that people with schizotypal personality disorder can be made aware of their suspiciousness, their magical thinking, and odd beliefs. It's harder to convince somebody with schizophrenia that they are very hard pressed in whatever it is that they believe. Schizophrenia is characterized by far stronger delusions. Nursing guideline, care. Respect the patient's need for isolation. Do not force them into social situations. Nurses should be aware of the patient's suspiciousness and employ appropriate interventions. Don't try to be overly nice. Don't try to force conversations. Make sure you always know where your exits are. Make sure you don't have your back to the patient. Make sure you're always facing the patient. Make sure you're always making eye contact with the patient. Remember, they have a very heavy distrust as it is already. Perform careful assessments as needed to uncover any medical or psychological symptoms that may need intervention, such as them having suicidal thoughts. Be aware that strange beliefs and activities like strange religious practices or peculiar thoughts may be part of their life. Those strange practices may be part of their life, so you need to be aware of it. Treatment. Psychotherapy. Remember, guys, there's no cure. There's no one medication we give to cure it. When it comes to personality disorders, and that's across the board, there is no cure. There is therapy and there is treatment. So we can do psychotherapy. However, look at what it says. Clinicians should be aware that these patients may also be actively involved in groups such as, oh, let me scroll down for you, sorry. In groups such as cults, unusual religious groups, and engage in occult activities. People with schizotypal personality disorder can benefit from low-dose antipsychotic agents, and these are for delusions that the patients may have, these hallucinations the patient may have, psychosis that the patient may have. If they're out of touch with reality, okay, we can give them antipsychotic meds, but it would be low dose. Why? Because those beliefs are not as deeply ingrained as the patient who has schizophrenia, okay, so they would get low dose. Depression and anti-anxiety can be treated with antidepressants or anti-anxiety agents. And guys, those are your differences between your schizoid and your schizotypal personality disorder. Next, I'm going to make sure I cover schizophrenia. That is the big one, schizophrenia for you. So in the meantime, guys, please let me know what you thought about this video in the comment section. Let me know what you'd like to see me cover. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And I'm asking you to please support this channel by sharing my content. Share it on your social media platform. Share it with a friend, a colleague, a classmate, even your nursing instructor. Guys, thank you so much for watching this video, and you guys will catch me on the next video.